So, good afternoon and welcome to voting list number 18. It is Monday, April the 8th. Today is sine die, our last day of session. This is the Health and Government Operations Committee. I'm your chairman, Jocelyn Peña-Melnick. To my left is my vice chair, Delegate Bonnie Collison. I want to say that this committee is staffed by 3 amazing women, and I'm very proud of that. And they're Erin Hapwood, Lindsay Eastwood, and Lindsay Rowe. I was thinking of this song, Lindsay, and Lisa Simpson, sorry. And they are, can you feature them, please? Because they're amazing. Like, we couldn't do this work without them. Okay. That is Lindsay.
We know her.
This is Erin. And where is Lisa? Lisa, come on, Lisa. Get up, Lisa. 1 minute. Come here. They're very humble people. And can I tell you that we could not do this amazing work without them and our committee. And our committee, Michelle and the interns did a little something that we're going to be sending to you so you can post. And some of the highlights for during the 2024 legislative session for the committee, we increase access to health insurance and care. We address prior authorization issues. We created a supportive continuing care program for individuals with serious mental illness, AOT. We increase insurance coverage for hearing aids, for cancer screening, the youth prosthesis. We require reporting requirement for birthing facility to increase safety for mothers and infant, Delegate White Holland. We develop a preliminary state artificial intelligence framework. We directed DO-IT to increase cybersecurity to protect personal data. We implemented a study to consider funeral alternatives to burial and cremation. We created a task force, a commission on reducing emergency department wait time, and so many other bills. And we have to be extremely proud of the work we did, but we could not have done it without the legislative analysts because they do the drafting, the amendment, and give us guidance on this bill. We also could not have done it without the different departments. Some of them I see in here, like the Department of Health, with Marie Grant, with the Secretary of Health, June Chung. All of you are amazing, Erin, and staff, Michelle, and Andrea, and Giselle, and Jose, and we have Edith, who is my chief of staff, Cassandra, who's in the front as well, and Osady. I mean, and all the interns, and I know they're listening, they're in the back, and they have been amazing, beautiful human beings, and our wonderful state trooper who has been with us this entire session. And all of you, all the delegates and senators, people at home don't realize the amount of work that this takes and the commitment and the passion and perseverance. And I want to highlight Delegate Robin Lewis. You did an amazing job on the floor. It was really wonderful. You knew that bill, you had compassion, passion, and you reflected us so beautiful. What an amazing, beautiful way to end our day today. So with that being said, we probably will have to vote on some concurrences, but we will get off the floor and do that in the silver room, okay? So the LAs can do a little exercise, get a little exercise in Michelle as well. And as you know, Michelle is having a beautiful baby boy, and he's the HGO baby, because that's our baby. And we're gonna claim him, and we can't wait to have him next session and to have him here as well. And for those of you at home and all the advocates and people that testify on the bills, thank you for contributing, and to the conversation and for being here, whether we agree or agree on things or not. I hope you feel respected and that you feel heard as well. With that being said, let's go on to Senate Bill 335, which is Health Occupations, Private Dental Offices, Infection Control. It came out as favorable. It is Lindsay.
It's identical accordingly.
It's been moved in second, and we're gonna go fast because we have seen these bills already, okay? With that being said, any questions or concerns? All those in favor say aye. Any opposition? Seeing none, it is unanimous. Let's go, and Delegate Bandari, is he here? You're gonna have that bill on the floor, okay? Senate Bill 986, it is State Board of Pharmacy Prohibition on Discrimination Against 30B Drug Distribution. It is favorable. It is Lisa. It's been moved in second. Any questions or concerns? Seeing none, all those in favor say aye. Any opposition? Seeing none, it is Gazzoni. Gazzoni, you're gonna have that bill on the floor. We now have we have a few concurrences. Who would like to go first? Erin?
House Bill 230, this was a departmental bill that authorizes the Motor Vehicle Administration to access and issue copies of death certificates and set and collect corresponding fees. There's an amendment that's been added that would give local health departments the same authority, and the House did the same amendment to the cross file.
Okay. Wonderful. Any questions, concerns? None. We're gonna concur as Delegate Kaiser suggested. Go ahead.
House Bill 119, this was a MDH departmental. It was the Giving Infants a Future Without Transmission Act, the GIFT Act. The bill altered terminology and requirements related to HIV testing and reporting, including requiring universal syphilis and HIV testing for all pregnant women at the time of delivery, newborn HIV testing when the mother's HIV status is unknown, and inclusion of pregnancy status when reporting an HIV diagnosis. The finance amendments made a clarifying change and also double the fines under existing law for the knowing and willful disclosure of personal identifying information acquired for purposes of HIV and AIDS reporting to any person who is not authorized to receive the information, from $1,000 to $2,000 for a first offense, and from $5,000 to $10,000 for a second offense. It's up to, correct? Yeah.
Okay. Yes, Delegate Kaiser.
I mean, I was also reading the face of someone who sits across from me. I was a little confused, the part about the knowingly transmitting. I would like to think that anytime certain health information would be knowingly transmitted was already a problem. So what is that new language?
This is current law.
Oh, okay.
It's current law.
Oh, okay,
It
good.
just is doubling the fines. for
Okay.
this.
I apologize. Thank you.
No, it's a good question so we're just doubling the fine, okay? Because that's awful if it happens, right? No one wants their information out there, especially something so sensitive. Any questions, concerns? So we're gonna move to concur? Okay, wonderful. All right, that's it. We don't have any more. This is it for us. We're gonna come off the floor if something else comes up, and I'll just like gather you and we'll go to the silver room, okay? Thank you for your time. Remember that you have